Since 1973, when the United States Supreme Court legalized abortion for the full term of pregnancy for any reason or virtually no reason, millions of unborn babies have been brutally denied the right to life, liberty, and the pursuit of happiness. Procured abortion is the unjust and violent taking of an innocent person's life. The Pro-Life Action League of Chicago holds conferences every year entitled Meet the Abortion Providers. At these conferences, former abortionists who have joined the pro-life movement tell their stories about what it was like killing babies and why they quit doing abortions. In this tape, we will meet these former abortion assistants, clinic owners, and doctors as they tell us precisely what abortion is. Let us listen to Carol Everett as she discusses the counseling given at the abortion mills.
Hey, let's talk about those kids when they find out that they are pregnant. They may not want an abortion. They may want information. But when they call that number that's paid for by abortion money, what kind of information do you think they're going to get? Let's remember they sell abortions. They don't sell keeping the baby. They don't sell giving the baby up for adoption. They don't sell delivering that baby in any form. They only sell abortions. I cannot tell you one thing that happens in an abortion clinic that is not a lie.
It's a lie when they tell you that they're doing it to help women, because they're not. They're doing it for the money.
So this girl calls this number and says, I'm pregnant. Well, how far along are you? What's the first day of your last normal period? And they've got their wheel there and they figure it out. Now this counselor is paid to be this girl's friend. She is paid to be the authority for this girl. She is supposed to seduce her into a friendship of sorts to sell her the abortions.
I was trained by a professional marketing director how to sell abortions over the telephone. This man came into our clinic and he took every one of our receptionists, all of the nurses, anyone that would be on the phone, and he took us through an extensive training period where we learned how to sell abortions over the telephone so that when the girl called, we hooked the sale. So she wouldn't go down the street and get an abortion somewhere else, and so that she wouldn't adopt out her baby, or so that she wouldn't change her mind. We were doing it to get her money. It was for the money.
And then there are two reactions in the recovery room. The first one is, I've killed my baby. And even then, it amazed me that that was the first time they called it a baby and the first time they called it murder. The second reaction is, I am hungry. You kept me in here for 4 hours and you told me I'd only be here for 2. Let me out of here. Now that woman is doing what I did. She's running from her abortion. She's not dealing with it. She's choosing to deny it. And she's the woman that we read all the statistics about, post-abortion syndrome. They say now it's an average of 5 years before people actually deal with the fact that, yes, they do kill their baby. And yes, they do have to deal with that. The 21-year-old that danced in, and I'll never forget her as long as I live, she was my son's age, danced in to get her problem taken care of, had the extra money to be put to sleep. And you see, my job with 2 of those doctors was to put my right hand on the baby and hold it while they did the abortion so I could tell them where the head was and where the legs were and all of that. And I had my hand on that woman's stomach. And that baby was perfectly inside her uterus. She had been examined by the doctor, and he said, yes, the baby was inside her uterus and everything was fine, and she was 24 weeks. And he went in one time, and he pulled out placenta. And he went in the second time, and he went through the back of her uterus and pulled her bowel out through her vagina. And we put her in the car because we didn't want an ambulance in front of the abortion clinic, and we took her to the hospital. And 7 doctors worked on her, and they did a colostomy on her. And when the reports came back, they said that it was an abdominal pregnancy, that it had not been in the uterus, and 7 doctors and a pathologist concurred with that. And then the hospital wrote off her bill, and there was no lawsuit, ever. She was told that would have been a normal complication. It was just amazing that she had made it that long. And she didn't know any better.
We can't eliminate abortions entirely. we can eliminate legal abortions. But safe legal abortions is a euphemism.
Now let us hear what encourages the doctors to perform abortions and what effects the women's rights movements have had on doctors.
The media was very active early on. It really was probably one of the major influences to us. It told us that abortion was, number one, legal, that it was to serve women, it was to give women a choice, more or less give them a freedom to grow and to take their rightful place in society where they had been kind of pushed down prior to that. We believed the lie that there were tens of thousands of women being maimed and killed from illegal abortions prior to the legalization of abortion law, and we all just kind of, it kind of made things feel a little bit better.
You are working hard to support the rights of women. What the hell is wrong with the other 750,000 little girls who got ground up in suction machines every year? I think at least in part it's because people don't know.
Medical technology has greatly aided in examining the unborn child. Ultrasound is often used by abortionists. It helps them to be able to see where the baby is positioned in order to carry out the abortion procedure.
But as we all know from the silent scream, the technology of ultrasound has the ability to open a window into the womb. When a woman sees her own baby moving on the screen, it has a profound influence on her, and I believe this is the technology which should be utilized as much as is possible. The abortionists also know that ultrasound can be a valuable tool in performance of an abortion for another reason. Dr. Sally Dorfman reported on the use of ultrasound during abortion at the annual meeting of the American Public Health Association of 1986. She recommended that it be used in all abortions performed after 12 weeks to accurately assess fetal age as a teaching tool and as a means of enhancing safety. It's interesting that they're doing all these things to enhance safety when it's such a safe procedure before they started using it. It is interesting also that she has warned against letting the patient see the image on the screen as, quotes, seeing a blown-up, moving image of the embryo she is carrying can be distressing to a woman who is about to undergo an abortion. She stressed that the screen should be turned away from the patient. She also addressed its effect on staff members and stated that they may need opportunities for venting their feelings and for reconfirming their priorities. What they really need to do is to look at the moving image on the screen and realize that they're about to take the life of a living human being.
We use that ultrasound machine on a daily basis. And again, it's like I say, yes, as a doctor, you know that these are children. You know that these are human beings with arms and legs and heads, and they move around and they're very active. But you get reminded every time you put that scanner down on somebody's uterus, you're reminded. Because you see the children in there, hearts beating, arms flinging. We have a ball with it. It's a lot of fun.
But I think the greatest thing that got to us was the ultrasound. That time, the ultrasound, or the sound wave picture, which was moving, called real-time ultrasound, showed the baby really on TV. The baby really came alive on TV and was moving. And that picture of the baby on the ultrasound bothered me more than anything else. Because, as I didn't know then really, you bond with that picture. Women get those pictures even if they're still pictures, and boy, it's their baby, and they put it up on the walls, they bring it in to show it to me, and the nurses that had to help with this had to look at this to stage how far along the D&E was, because you got paid more if it was, 16 weeks, if it was more if it was 18 weeks, and so on. In other words, the larger the pregnancy, the more you got paid. And the more the clinic got also. So it was very important for us to do that and to make sure they weren't too large for us to do when we started. We lost 2 nurses. They couldn't take looking at it. Some other staff lost. The turnover got greater, when we started doing the D&Es, and mostly, as I said, the ultrasounds. So I think the ultrasound was one of the keys there. The other thing, too, is, of course, the women who are having the abortions are never allowed to look at the ultrasound. And because we knew even if they heard the heartbeat, that many times they wouldn't have the abortion. And then, we didn't want that, no money in that.
Is abortion a lie? Does it promise a better life? Or does it deliver death? Let us hear then what it is all about and what really happens to both the baby and the mother in an abortion.
Because a lot of people don't know what abortion is about. They don't know what is being aborted, and they don't know how it's being done.
I used to think of abortion as eliminating a problem instead of killing a baby.
I killed my baby, and I'm still not through that. And how difficult it is for all of these women. Because you see, I believe every woman, whether even if she's not physically harmed, is harmed by abortion.
And I would work up there, and this woman forced her daughter to come in there, and she was the second trimester, probably about 15 weeks. And they had inserted the laminaria the day before, and she was in there, and she was miserable, that poor girl was. And she was really upset. She kept going to the bathroom, and obviously there was something wrong with her physically. And when she went into the bathroom the next time, all of a sudden she started screaming at the top of her lungs, "It's a baby! It's a baby! Mama, mama, mama!" And she was screaming at the top of her lungs in the middle of our clinic that she's going to be scarred emotionally from having seen that baby in the toilet, because that's where it landed.
I was told that one of the pro-life problems is that we talk too much about the babies being ripped apart. We show terrible pictures. We dwell on these too much. But what are we supposed to do? This is the reality of abortion. I'm there to tell them the truth. Babies are being ripped up. Yes, these babies do look like this after an abortion. And yes, it does hurt your baby. And most of all, it does affect the woman.
There are no words to describe how bad it really is. It kills the baby. And yes, I've seen sonograms with the baby pulling away from the instruments as they're introduced into the vagina. And I've seen D&Es through 32 weeks done without the mother being put to sleep. And yes, they hurt, and they are very painful to the baby, but yes, they're very, very painful to the woman. I've seen 6 people hold a woman on the table while they did her abortion.
My job was to take the baby and to take it into the lab. We would take it out of the little sack, lay it in the pan. The doctor would then come in and examine it. If he felt that it was adequate enough tissue, we would take the baby, put it into a jar, and send it to the lab if she had insurance. If she had no insurance, the baby was just simply put down the garbage disposal.
Oftentimes, second trimester abortions were performed, and these babies we would not put in the little jar with the label to send out to the pathology lab. We would put them down a flushing toilet, and that's where we would put these babies. They knew that they couldn't turn them in or they were going to be found out that they were doing abortions which were too big. What did we do for fetal disposal? Well, they basically put them down the garbage disposal if they were small enough, and that was what we did. We hardly ever sent anything to the laboratory for pathology unless there was something weird going on and the doctor wanted to make sure he wouldn't get sued. That was the only reason he sent it, was to keep from getting sued. And then, of course, we started giving them the larger babies to the University of Texas Health Science Center. Right before I left, Dr. Boyd had made an agreement with a doctor, and I cannot name this doctor because I just don't think it would be wise to name him today, but he was the director of fetal research at the University of Texas Health Science Center at that time, and he had made an agreement with this doctor to give him our large babies for him to do fetal research on. And they did this, and I believe at the time it was against the law. Now, I don't know if it is now, and I'm not familiar with the legal terms because I'm not a lawyer, but I remember we were told not to tell anyone, and they only came in secret to get the babies.
The other abortion is the saline, which is after 16 weeks of pregnancy. This has to be done in the hospital because of complications that can arise. Not that they can't arise during other times, but more so now. The saline is injected into the woman's sac, and the baby swallows the saline, and it's a salt solution. And the baby starts dying a slow, violent death. The mother feels everything. And many times it's at this point when she realizes, or she's facing reality, that she really has a live baby inside of her, because the baby starts fighting violently for his life. He's running, just fighting inside because he's burning.
No more with the saline. You trade one kind of brutality for another. Well, I'll tell you one thing about D&E. You never have to worry about a baby being born alive. And that's one positive aspect of it, perhaps, if you want to put it that way. If any of you don't know what D&E is all about, I'm not going to describe it other than say, as a doctor, you're sitting there tearing, and I mean tearing, you need a lot of strength to do it, arms and legs off of babies and putting them in a stack on top of a table. If any of you don't know what a D&E is or what it looks like, I'm going to strongly refer you to Dr. Nathanson's film, Eclipse of Reason. I think it's an absolutely superb piece of work, and when that film's over, you're going to know what D&E is all about.
Because you see, when the babies are so big, they don't come apart like the others. They come up, the muscle structure is so strong that the heads come off from the body, and you can't dispose of those in the disposal. You have to put those in the trash.
The baby's bones were far too developed to rip them up with this curette, and so he had to try to pull the baby out with forceps, which he brought about 3 or 4 major pieces, and then he scraped and suctioned and scraped and suctioned, and there this little baby boy was laying on the tray, and his little face was perfectly formed, just like the sign you saw, perfectly formed. Little eyes were closed, and little ears, and everything was perfect about this little boy.
There was one incident where a white piece came out, and I asked the doctor later on what it was, and it was the baby's skull. And I can still, to this very day, hear the crushing noise of that baby's skull being crushed.
When the babies would be put in the jars, we would hold them up and we'd kind of twirl them around and look at the little arm, you know, and the leg float up, and we'd go, ooh, you know, and we'd put it back in the box. And as sick as that sounds, that's the way it was. It's the way it is a lot of places right now.
Let us listen to these former abortionist stories.
As part of my training, I was taught to do abortions. As I've never been involved in a large-scale abortion mill, a business that was, and it is a business, don't kid yourselves, a business that was set up with the sole purpose of performing abortions. My experiences are perhaps a little more universal in terms of obstetricians and gynecologists in the country who were trained to do abortions during their residencies and then continue doing so as a part of their private practice, but not even the major part. Certainly it was never a major part of our private practice. We're going crazy trying to find a baby to adopt, and here we are, so we started desperately looking for a baby to adopt, and I'm throwing them in the garbage at the rate of 9 and 10 a week. And it even occurred to me then, it's like, I wish one of these people would just let me have their child. But it doesn't work that way. We were lucky. It still took 4 months. We had adopted a healthy little girl. And we were satisfied. We called her Heather. Why a doctor changes his mind is, you know, we can talk about why doctors do abortions, and I think that the reasons tend to be more or less universal. But why doctors change their mind, I think, is, my guess at least, is very personal. I think it's going to be very different from one doctor to the next. As I said, my reasons for quitting were a lot more personal, but maybe, I hope, you can draw something from it. Life was good until June 23rd, 1984. On that date, we had, I was on call, but I was at home at the time, and we had some friends over, and our children were playing in the back of the yard. And at 7:25 that evening, we heard the screech of the brakes out in front of the house. We ran outside, and Heather was lying in the road. We did everything we could, and she died. Let me tell you something. When you lose a child, your child, life is very different. Everything changes. And all of a sudden, the idea of a person's life becomes very real. It's not an embryology course anymore. It's not just a couple of $100. It's the real thing. It's your child you buried. And the old discomforts came back in spades. I couldn't even think about a D&E abortion anymore. No way. And then you start to realize this is somebody's child. I lost my child, someone who was very precious to us. And now I'm taking somebody's child and I'm tearing them right out of their womb. I'm killing somebody's child. That's what it took to get me to change. I began to feel like, my own sense of self-esteem went down the tubes. I began to feel like a paid assassin. That's exactly what it was. You watch the movies, somebody goes up to somebody, pays them some money to kill somebody. That's exactly what it was doing. And when my own sense of self-esteem went down the drain, that was all it took. It's still old habits die hard. But it got to a point, and Sis and I talked about it together, that it just wasn't worth it. It wasn't worth it to me anymore. The money wasn't worth it. Poor women, my butt. I don't care. This is coming out of my hide. It's costing me too much. It's costing me too much personally. For all the money in the world wouldn't have made any difference. So I quit.
So I was able to go off to Memphis, Tennessee, where the medical school was, and start studying about this human body of ours, so fearfully and wonderfully made. And I really believed all the trash those secular humanists were telling me, that we were not a special creation of God, that instead we had evolved up out of the mud, a la Darwin, and this was all just accidentally put together. I made my decision to be an abortionist right here in this city back in 1969. And I really felt like these women ought to have a safe abortion, and I would provide it. I think my coming out of the abortion situation, I've heard other people talk about their experiences, and it seems to be sort of similar. It doesn't happen all at once. I would go in and meet my well-counseled patient. I would examine her, and then I would do the suction D&C procedure under a paracervical block. After it was all over, I would leave my patient on the table, and I would go over to the suction bottle, and I would take the little stockinette out. I'd go outside the room to a sink where I'd open this stockinette up, and I personally would pick through it with a forceps, and I would have to identify, 4 extremities and a spine and a skull and the placenta. If I didn't find that, I would have to go back in that room and scrape and suction some more, or else my patients would be showing up in 48 to 72 hours, just like those women at Cook County with an infected, incomplete abortion. And standing at that sink, I guess I just started seeing these bodies for the first time. I don't know what I did before that. I think I just counted. I was cool, blood didn't make me sick. I could handle all the guts and gore of medicine just fine. But I started seeing this for the first time, and it started bothering me.
And I can remember that day watching the first abortion with the resident doctor sitting down and putting the tube in and removing the contents. And I saw the bloody material coming down the plastic tube, and it went into a big jar. First one. I'd never seen one before. I didn't know what to expect. Well, it was my job afterwards to go and undo the jar and see what was inside. Well, it was kind of neat, learning about a new experience. I wasn't a Christian. I didn't have any views on abortion. I was in a training program. This was a brand new experience. Going to get to see a new procedure and learn, and that was exciting. And it got more exciting as I opened the jar and took the little piece of stocking and opened that little bag, and the resident doctor said, "Now put it on that blue towel and check it out. We want to make sure that we got it all." And I thought, oh, that'll be exciting, hands-on experience looking at tissue. And I opened the sock up and I put it on the towel, and there were parts in there of a person. I'd taken anatomy. I was a medical student. I knew what I was looking at. There was a little scapula and an arm, and I saw some ribs and a chest, and I saw a little tiny head, and I saw a piece of a leg, and I saw a tiny hand, and I saw an arm, and you know, it was like somebody put a hot poker into me. I believe that God gives us all a conscience, and I wasn't a Christian, but I had a conscience, and that hurt. So I checked it out, and there were 2 arms and 2 legs and 1 head and so forth, and I turned and said, I guess you got it all. And that was a very hard experience for me to go through emotionally. If I'd been a Christian against abortion, it would have been simple. I wouldn't have been there. And if I'd been excited and wanted to do them, and excited about the money that I make later in practice, I would have been on the opposite end. But here I was with no real convictions, caught in the middle. And so I did what a lot of us do throughout our life. We don't do anything. I didn't talk with anybody about it. I didn't talk with my folks about it. I didn't think about it. I didn't look in the Bible because I wasn't a Christian, and so I did nothing. And you know what happened? I got to see another abortion. And you know what? That one hurt too. But I didn't do anything again, and so I kept seeing abortions. And you know what? It hurt a little bit less every time I saw one. And you know what happened next? I got to sit down and do one. Because you see one, you do one, and you teach one, as Dr. Hill mentioned. Well, the first one that I did was kind of hard. It was like hurting again, like a hot poker. But after a while, it got to where it didn't hurt. My heart got calloused. My heart was calloused against the fact that I was a murderer. I was just simply uncommitted.
Now I'm going to stand here and tell you that I am a murderer. I have taken the lives of innocent babies, and I have ripped them from their mother's wombs with a powerful vacuum instrument. And when they were too big to do it in that way, I've injected a concentrated salt solution into the bag of waters to slowly and painfully poison them, and then to cause labor to follow. As I close my presentation today, it should be obvious to you that my participation in abortion was not as an avid abortion proponent, but as a reluctant puppet in a world gone berserk. Unfortunately, there are many such puppets today without the courage to admit that what they're doing is wrong. And every year there are more puppet physicians and nurses who are added to this number. I've had the opportunity to speak to groups of medical students and nurses in training, and my advice to them has always been, when they're asked to provide abortion services and to get involved, they should simply say no from the beginning.